Hey everybody, thanks for joining me today, Dr. Ross Marcagiani at Turnpaugh Health and Wellness Center with another great word of the week. Today's word of the week is going to be osteoporosis. We're going to talk about what is osteoporosis, how does someone get osteoporosis or how does this occur, and then how do we slow the progression of osteoporosis. Let's dive in. So for our viewers, this is also in reference to osteopenia, which is 1 degree less than osteoporosis. So if you do have the diagnosis of osteopenia, this would be a beneficial conversation for you to listen to as well. So what is osteoporosis? Osteoporosis is the decrease of bone density in demineralization of the bone. So the bone becomes more weak, more brittle, a much higher risk for fracture. As we mentioned, and you can see in this picture, the bone becomes more porous. So you can see the bone, you can see the trabeculae, which are which is the inside, kind of the lattice structure of that bone. You can see the healthy bone, there's much smaller air pockets. And then on the right, the bone becomes less dense, and there looks like that there's larger air pockets, right? That is osteoporosis. And then osteopenia, again, a lesser degree, would just not look as severe as the picture on the right. Typically, areas of risk for fracture, the main concern being the hip, the femur, typically like the femoral head or the femoral neck, which is part of your leg that attaches to the hip, and then typically your lumbar vertebrae. But your vertebrae in general, that's your spine, is at risk or increased risk for compression fractures. And typically gold standard here is to have a DEXA scan run. Basically, it looks at the density and the quality of the bone. Usually anything greater than negative 2.5 or greater, so if you have a result of 2.8, that is considered osteoporosis. Now typically, that's a T-score that you want to look at. Now typically anything less than negative 2 is considered osteopenia. So if you have a negative 2.1, you would fall in the category of osteopenia. Again, anything greater than negative 2.5, 2.6, 2.7, etc., you now fall in the osteoporosis category. And this is really important because typically elderly women, men can have osteoporosis or osteopenia, but they're at risk for injury with a fall. And once typically they have a fracture, it's hard to recover and heal from that. The healing process is much slower. Now you take away their ability to move, their ability to ambulate, and life expectancy goes down significantly from there. So we want to make sure we prevent any fractures or any osteoporosis or osteopenia. So how does osteoporosis occur? So like we talked about, typically in women, but it can happen in men. Men can have osteopenia, osteoporosis. Typically excessive like alcohol use, poor diet, smoking, people with hyperthyroidism, diabetes, Cushing's, which has to do with cortisol, rheumatoid arthritis, celiac disease, hyperparathyroidism. These are all conditions that would increase your risk to osteoporosis. So we want to make sure that if we do fall in one of those categories, that we're taking extra attention in regards to the prevention of osteoporosis. Typically, bone loss can start around age 35. That's when bone demineralization starts to occur. And we see that typically the most common time to fall into osteopenia, osteoporosis, is for women typically about 5 to 10 years after menopause, more towards the latter on that scale. So that's something to be aware of. And the reason why here is because, as people should be able to tell here, after menopause, we're now stopping or reducing, I should say, the production of hormones, the production of mainly estrogen. That's a big contributor, but progesterone and testosterone. have a big contribution to bone mineralization. So that's something to be aware of. Also, people that are taking medications, now this isn't to say stop taking medications at all, please don't take that, but I just want you to be aware, certain medications increase the risk of demineralization, such as our steroids, which is prednisone, such as our antacids, which would be Tums, things like that over the counter. Your anticonvulsants, which would be Keppra, Ativan. These can decrease bone mineralization. And then your loop diuretics, such as Lasix, that helps with hypertension or congestive heart failure. These medications can decrease bone density. Then how do we slow the progression here? So the conventional approach is to use bisphosphonates. And typically the most common bisphosphonates are your Actonal or your Fosamax. Now, there are some potential side effects that can come with this. So it's very easy: gas, constipation, joint pain, in severe cases, osteonecrosis, meaning damaging of the bone, increased risk for fractures. It can also cause allergic reactions potentially. So there are definitely some potential side effects to taking the bisphosphonates. Now, the thing that we want to focus on is a proper nutrition, well-rounded diet here. So we want to try to make sure we avoid highly acidic foods. We want to try to make sure we avoid carbonated foods. Obviously, by now we should know that keeping your sugars low is crucial. Keeping adequate protein intake, so anywhere from 0.8 gram to 1 gram per kilogram of body weight is a pretty good ratio for protein intake. We want to make sure that we're keeping a very high antioxidant and well-rounded diet here. Again, going back to my gold standard is a good paleo diet, keeping the carbohydrates low, adequate amount of protein, adequate amount of fat, and then we're getting our carbohydrates from good vegetable sources, which are going to be high in a lot of these trace elements and other supplements that I'm going to be talking about in just a minute here. The research on weight-bearing activity for help improving osteoblastic activity, so that's bone building, is crucial. Now, yes, going out for a walk is helpful, but actually weight training with someone who has done this professionally and knows how to write correct exercise prescription and design a program that gives you weight that's not going to cause further injury, but actually putting a load on the skeletal structure helps to increase bone formation. That's a law called Wolff's Law. So that's something that we want to take a look into. And everyone goes to, we just take calcium and vitamin D for bone mineralization and increasing bone mass density. Yes, but there are more things that we can do than just a calcium and vitamin D. So one thing that's commonly talked about, negative and positive, is HRT, hormone replacement therapy, mainly with estrogen, because again, after menopause, this is when the estrogen, progesterone, testosterone start to drop, and we start to see further decrease or exponential decrease in bone mineralization. So the drawback is that with estrogen replacement, there is thought to be increased risk for various cancers and other cardiovascular conditions. So my caveat to you would be, if you're thinking about this, make sure you're doing it with a professional who knows what they're doing, making sure that I would make sure you're being microdosed first, so very, very small amounts, and having your blood analyzed to make sure you're not overdosing, making sure you're getting bioidentical forms, so that your body's not having to convert the hormone over in producing harmful metabolites. So looking at the potential of using bioidentical estrogen, using bioidentical progesterone, and yes, even in some cases, testosterone. But there's been some support that DHEA, dihydroepiandrosterone, has been more effective in increasing bone mineral density in women than testosterone. So I would start with DHEA first before going into testosterone. And then if you're a little bit concerned about taking estrogen, using genistein, which is an isoflavone that helps to increase, it has mild estrogenic factors. So it can increase your estrogen output very slightly, which will help to increase bone mineralization, which is a little bit of a safer approach than taking bioidentical estrogen. But still, bioidentical estrogen could be a proper mechanism for you depending on your history. Also, using magnesium, vitamin K, B vitamins, copper, manganese, zinc, phosphorus, vitamin C, vitamin A. We already talked about DHEA. These are all supplements or either minerals, trace minerals, or other supplements that help to do one of many things. Either increase osteoblastic activity, so you hear osteoblastic activity, that means building, helping form hydroxyapatite lattice structure, or increase cross linkages in the bone matrix. So all of these do one or more of those aspects to the bone and help increase bone mineral density. Now, another aspect you want to look at is your homocysteine levels. So homocysteine or hyperhomocystinemia, so basically means high homocysteine levels, has been shown in research to cause decrease in bone mineral density. So one of the factors why including B vitamins into your daily regimen is going to be helpful, because B vitamins can drop homocysteine levels. As we mentioned earlier, checking your thyroid, making sure our thyroid's not hyperactive. If it's overactive, we're going to do more bone breakdown than bone buildup, okay? And we want to test for heavy metals, really important, like looking at a lead, aluminum, cadmium, tin at really, really high levels can affect the bone. Strontium at high levels can affect the bone. But I won't get into that because strontium has been shown about 1 to 3 milligrams a day has helped improve bone mineralization. But if you overdo it, it can have an adverse reaction. That's strontium. But again, looking at your heavy metals, making sure your heavy metals are not binding and chelating some of these other helpful elements here to the bone. Also, looking at making sure we're not over intaking our caffeine or over intaking our sodium levels. Both of these have been shown to increase urinary calcium levels, meaning it binds or inhibits the absorption or decreases the absorption of calcium, so you now end up urinating out the calcium and it doesn't get absorbed into the bone. So being aware of that. I hope this video was helpful. If you're someone who's concerned about this, please don't hesitate to reach out to the office. And if you know someone that can benefit from this information, please share this information with them. Thank you for your time and have a great day.